So Dr. Joe, I'm having trouble and pain in my wrist and my hand from my pinky down my wrist, and I just wanted to know, how do we treat it?
So I'm gonna show you how to use the instrument assistive device. Release your tight muscle, adhesion, scar tissue. We can break it up with a metal. We're gonna do a little muscles in your tendon area, and then the problem area is gonna getting red. You feel a little discomfort, this wrist joint area, right?
Mm-hmm.
So I'm gonna a little scraping.
Right here.
Yeah. Here, okay. So I'm gonna a little scraping your muscles and then tendons. Yeah. It turns right away, the red, right? So that's the area you have a little tight tissue, a little tissues are stuck each other. We call it like an adhesion. Yeah. So this is a little diagnostic tool. So the problem area is getting more rough sensation and getting red easily. Yeah. So here's red, and here is red. But this tendon has a little tightness. Yeah. Little bit, yeah. And then your forearm, your muscles, a little red here. Yeah. Sometimes, a few times can make it worse. If you very tight and you do it too strongly, then can make it irritated. So gotta be careful. Yeah. But when I feel this is not super tight. This can be handled by this metal scraping tool. Yeah. Definitely here. Yeah. You keep using your tendon, and the tendon has in the inside. And then you can turn this way, down. Yeah. This is wrist extensor. So here is tight. Okay, good. Check. Check how you feel. Do you feel looser or sore?
It does feel looser, but it also feels sore.
Usually 1 to 2 days sore after treatment, and then it gets much better. Yeah. Okay, we're gonna use the shockwave therapy. Shockwave therapy has 2 types. One is a radial shockwave, and then the second one is a focused shockwave. This is a focused shockwave, and this is good for the tendons, ligaments, muscles, insertion area up to the bone. Focused shockwave is very good for the ankle sprain, and then your toes and fingers. Any dysfunctional tissue you have, you're gonna feel some discomfort. So it's diagnostic too. So if you have a healthy tissue, you don't feel anything. If you have a dysfunctional tissue, you're gonna feel discomfort. So let me know when you feel discomfort. I'm gonna start slowly. Intensity level is 2 out of 18 right now. Yeah, so let me know when you feel. Okay, so what the focus shockwave does is the problem area muscle is so tight, and then that's squeezing the blood vessel. Blood vessel is a little shrink. So this is dilate the blood vessel, releasing the muscle, and then that brings a lot of blood in, and then attracting some healing factors such as a stem cell. So it's attracting those healing factors, and then release the muscle, release the trigger points, scar tissue, adhesions. This is also release, normalize it. Yeah. And then help promoting making the new blood vessels. Yeah. So when you feel better, let me know. It can take some time if that area is a very disturbing area. Yeah, like a hip area, like a back area.
Gotta stop holding my phone so much.
Yeah, you just keep holding in the same position, then it's getting really tight. Yeah. So first treatment we do it, and then next treatment you feel better. Then I increase the intensity. So we just keep doing that, and then every session you're gonna feel better. You have a healthier tissue, then you don't feel much, then we increase the intensity. Okay, check how you feel.
It feels looser.
Looser, yeah. Next time we gotta treat the back.
Yeah.
But this one must be good right now. Okay, Nicole, so we treated your last time the front side, your wrist flexor. How do you feel after treatment? 2 days ago, right?
Yeah.
Yes.
It feels looser. It is still a little bit sore, but I do feel more strength.
Gotcha. So let me see your strength. So a little bend your wrist. Yeah, hold it. That's pretty strong. Yeah, and turn, and then turn and up. Hold it.
Now.
Where do you feel discomfort?
right in the middle knuckle.
Got it. Yeah. So we're gonna treat your the backside, the wrist extensors, and then your extensor finger muscles, tendons there. So let's begin with focused shockwave first. Yeah.
Okay.
So let me know as I told you, the problem area where you have a dysfunctional tissue is you're gonna feel discomfort, and this machine is diagnostic too. Yeah.
Yes.
Let me know.
Yes.
Here. Okay.
Yes.
Yep.
Ooh,
Do you want me to go lower or bearable?
that's bearable.
Okay. Yeah, so usually you're sensitive at the point 3. That means you're a little inflamed and you have a little, sensitive. Yeah, in this kind of case, it's good to massage every day by yourself. You can just put any lotion and then giving a little massage every day, 2 or 3 minutes. Especially after using your cell phone and typing a lot, you should do stretching, and then you can do ice. No hit, ice.
I feel it in my palm, which is very interesting.
It goes deep, yeah.
Yeah.
This is it today, and then I'm gonna do some manual metal scraping. So I have this metal instrument, yeah.
Okay. I'm scared.
Let me see. Yeah, around the bone, always around the bone, there's a little adhesion trigger point.
Yeah.
This one's so sensitive, yeah.
Yeah.
Yep, there's a little trigger point there. Manually, a little pressing also release some amount of the tightness, yeah. So around the bone, there are always a lot of adhesions and scar tissue trigger points because tendons, ligaments are attached there, and then there's a lot of tension when you are using it. So that's creating sometimes a micro tear and inflammation. Yeah. But every day you massage, just put some lotion and massage every day. That's decreased sensitivity. So I recommend keep doing it every day. Yeah. When you massage, you can massage it soft, and also you can use a knuckle, and then you can give a little pressure. Massaging soft is good for circulation, blood circulation, lymph circulation. Yeah. And give a little pressure, then that's a little more release the deeper muscles. Yeah. And then when you find a very sore spot, then you can keep maintain pressure over there 20-30 seconds. Yeah. That helps releasing trigger points. Yeah, trigger points. Okay. Let's use the tool. Yeah. Okay. The rough area is the problem area. This is rough here. Yeah.
Wow.
Okay. Yeah. So I can release the whole muscle. It starts from you, and then it's going down there.
Yeah.
The tendon is going down and attached on your metacarpal bones.
Oh wow.
Painful?
No. It's just a different sensation.
Yeah, so when I'm using the instrument, this kind of very tight area, you gotta be a little careful. If I do too strongly on that very tight area, sometimes it aggravates. But after the shockwave is loosened up, so it's much better. Yeah, I think I'm not gonna do too much. Next time I can do a little stronger. Yeah, the main area is here.
Yes.
Yeah. Just bring it back to your lymphatic system, back to lymphatic drainage system.
It's very cool.
Okay. Check the movement. Yeah. Right now I cannot check your strength because it's gonna be very sore. So it's gonna take 1-2 days to heal.
I feel better support.
Better supporting
on this side.
Yeah. But
and both sides, but this side.
Yeah, the wrist flexor strength was good because we treated last time. So it's gonna be here 1-2 days. So you can just put some heating pack. You can put some lotion, keep massaging and stretching by yourself, and then you can use the bowl to release the inside the muscle. After treatment, drink enough warm water. Yeah, and the rest.
Okay.
Yes.
Good.
Yep.
And I'll stop gripping my phone.
Yes. That's true. That's important.